You're at the pharmacy counter. 20-minute wait. The pharmacist finally calls your name, bags up your medication, and says, "That'll be $45." Most people reach into their wallet without thinking. Insurance card out, credit card swiped, receipt pocketed. You used your benefits. Responsible adult stuff. But that same medication, same pills, same bottle, same pharmacy, might have cost you $4 if you just kept your insurance card in your pocket. Using your insurance can cost you more, a lot more. And most people have no idea it's happening.
Hey everyone, Alex here. I think about how money actually works for a living. Not how it's marketed, but how the math actually plays out. And healthcare is one of the most consistently misunderstood areas I've ever looked at. So today, the $4 prescription thing, where it comes from, why we keep overpaying, and how to stop. Subscribe if you're into this kind of thing. Let's get into it.
Most of us turn off our consumer brains the second we walk into a medical setting. We'll spend 45 minutes comparing credit card rewards programs. We'll haggle over cable bills. We'll do unit price math on paper towels. But at the pharmacy or billing desk, we go quiet. We take whatever number we're given and feel grateful we have coverage. Here's what's actually happening. You pay a monthly premium just to have the policy. Then you have a deductible, what you owe in full before insurance starts covering anything. Then copayments, fixed amounts per visit or prescription. Then coinsurance, a percentage you owe for certain services after your deductible's met. The industry justification for all of this? High out-of-pocket costs encourage you to shop around, which supposedly drives prices down through competition. But they've made shopping around functionally impossible. Hospital price lists are a mess of billing codes. Comparing prices across facilities requires knowing the exact technical identifier for each service, down to individual medications and supplies. So people don't bother. They trust the copay. They assume the negotiated rate is the best available. Often, it isn't. Say your doctor orders a lower back MRI. You go to an in-network imaging center. They bill your insurance $5,000. And your policy carries 50% coinsurance on the procedure. You get a bill in the mail for $2,500. Expensive, but MRIs are expensive, right? You pay it and move on. According to data from clearhealthcosts.com, the cash price for that same MRI at that same facility might be $930. No insurance involved. You just walk in and offer to pay up front. With insurance, $2,500. Without, $930. A $1,570 penalty for using the benefit you pay thousands a year to hold. And this isn't only happening with big procedures. It's at the pharmacy counter constantly. Walmart and Target sell 30-day supplies of common generics for $4, 90-day for $10. Hand over your insurance card for the same drug, and your copay might be $15 or $20. The system processes the insurance rate automatically. You pay 4 times more without realizing it.
The thought that comes up here, I pay thousands in premiums every year. Shouldn't I actually use what I'm paying for? That instinct is the trap. Behavioral economist Richard Thaler has written about how emotionally loaded healthcare spending feels. We hate paying out of pocket when we're already sick. We hate the feeling of deductibles. So because we've already paid so much in monthly premiums, we reframe the insurance card as a discount pass, a membership we've already paid into, so everything through it must be the better deal. We just don't shop for healthcare the way we shop for anything else. At a car dealership, you assume the sticker price is negotiable. Buying electronics, you check a few sites first. At the hospital, we accept the number and feel relieved we have insurance at all. We're scared of the system, so we trust the card. The card often isn't protecting us. It's locking us into a pricing system that's more expensive than the alternative. The part that confuses people: why would a hospital charge you less for not using the insurance they spent months negotiating contracts with? Because insurance is expensive to collect. When a hospital bills an insurer, they employ whole departments to handle it. Medical coders, billing specialists, people who do nothing but fight automated claim denials. They submit paperwork, wait for approval, appeal rejections, and often wait 60 to 90 days to see actual money. The overhead is real. When you pay cash today, you're cutting all of that out. They get clean money immediately with zero administrative cost. That's the trade. A $5,000 MRI becomes $930 because you've saved them the bureaucratic headache. The insurance billing system also breaks your bill into as many components as possible. Separate fees for supplies, labs, specialist consults you didn't know you'd be getting. Some hospitals charge room fees for spaces you sat in to fill out forms. An ophthalmologist may add a refraction fee on top of your exam. If you're at an urgent care and they swab your nose, that swab may get sent to an out-of-network lab, a bill your insurance won't fully cover, without anyone mentioning it. Cash patients often avoid the worst of this. Flat-rate pricing sidesteps a lot of the line-item billing.
A sinus infection. Not serious, just miserable. Dave has a solid job, contributes to his 401k, good PPO plan. He goes to an in-network urgent care, pays his $50 copay, sees a doctor for 6 minutes, gets a generic antibiotic, pays another $20 at the pharmacy. Total? $70. He feels like he handled it responsibly. 2 months later, 2 bills show up. The urgent care billed his insurer $450 for a level 4 new patient visit. Negotiated rate? $300. Dave hasn't hit his $2,000 annual deductible yet, so insurance applies the $300 to his deductible and pays nothing. After his $50 copay credit, he owes another $250. Then a second envelope. The doctor sent his nasal swab to an outside lab that wasn't in Dave's network. Classic balance billing. An out-of-network provider assigned without disclosure. Insurance barely touched it. Dave owes another $150 more. Total for a sinus infection? $470. If Dave had walked into that same urgent care, left his insurance card in the car, and just asked, "What's the cash rate?" the answer would have been $99. Cash patients get an in-house rapid test instead of an outside lab. He takes his prescription to Walmart, skips the insurance card, pays $4. Total? $103. Same infection, same outcome, $367 difference. Ask for the cash price before you hand over your card. For any routine visit, imaging, or prescription, ask, "What's your self-pay price without insurance?" If it's lower than your copay, use it. This is the only habit that matters, and most people never do it. Use tools that show you real prices before you go. ClearHealthCosts.com has crowdsourced pricing data for procedures in major cities. For prescriptions, GoodRx and Blink Health show you discount rates at nearby pharmacies, frequently cheaper than insurance copays. Move common maintenance prescriptions to big box store generics lists. Search $4 prescriptions, and you'll find Walmart, Target, and Costco generic drug lists. If you're on a recurring prescription, check if it's on the list. Transfer it, pay cash, skip the copay math entirely. If you do use insurance for a hospital visit, fight the first bill. Call billing and request an itemized statement. Errors are common. If you were balance billed by an out-of-network provider at an in-network facility, dispute it. That's a billing practice with legal limits in many states. For large bills, the Alliance of Claims Assistance Professionals connects you with advocates who audit medical bills professionally. Health insurance exists to prevent financial ruin from catastrophic illness, a heart attack, cancer, a serious accident. That's what it's built for, not to get you the best rate on a generic antibiotic. You don't file a homeowner's claim when a light bulb burns out. You buy a light bulb. When you start treating everyday medical spending like any other purchase, where the price is worth asking about, you stop defaulting to a system that frequently charges you more for the coverage you're already paying for. Building wealth is mostly about understanding how the systems around you actually work, not just how they're explained to you. If this changed how you think about your next pharmacy run, let me know in the comments.